from the News Channel 5 Network. This is Out and About Today. Sponsored by the Tennessee Performing Arts Center.
Welcome to Out and About Today. I'm Brent Meredith. Thanks for joining us. We've put together another special in-depth show for you tonight. We're going to be discussing an upcoming LGBTQ Community Health Fair, and I'm certain you'll want to save the date for this. So joining me now with more details are Selena Haynes, Connect Media Group co-founder, and Ray Zimmerman, Director of the Office of Diversity Affairs and LGBTQ Health at Vanderbilt University Medical Center. Welcome, you guys. Thanks for having such long titles.
Thank you, Brent. Good to be with you today.
Yeah, no, that's good to see you both. So in the intro, I mentioned the health fair, which I definitely want to get to. But as we're sitting here tonight together, and there may be some folks watching who don't know you guys, and maybe you need a little bit of background on who you are and kind of why we should take your word for it, I thought we might start with a little background. So I'd love to hear a little bit of your story and sort of how you ended up at Nashville and sort of what brought you here. Selena, we could start with you. How did Middle Tennessee become your home, and how did Connect get started?
Well, thank you so much for allowing us to be here today. We appreciate it. And I am from West Tennessee originally, a native Tennessean. I moved over to Nashville in 2005 for a job. And I actually met my wife at this particular job. And so we started dating. And so I decided I'd stay. So,
I'm sure she was glad to hear that too, right?
Yeah, she'll be happy to hear that. So, but we have been involved in the community through activism for the past few years. And we saw a need for a media company here that did focus on LGBTQ community. We did have some prior experience with a different brand, but we decided that it would be better to rebrand or start over. So that's how Connect kind of formed. And we are 100% LGBTQ owned and community based. So we love to hear feedback from the community on anything that they may have to say.
Fantastic. No, that's great. And it's so important, especially these days in local communities, for any group to have somebody locally covering themselves instead of, somebody outside of the city, as some other publications are these days. But Ray, kind of a similar question to you. Folks watching tonight, may know you from your work there at Vanderbilt, but how did you end up calling Nashville home, and how did you end up in your role there now?
Sure, goodness. I've lived in Nashville for 25 years and moved here right out of college, and this has just been home, and so proud to be here, like Miss Minnie Pearl. I've spent a long time volunteering in the LGBTQ community, and long about 2016, I was looking for new professional opportunities, saw an ad for a position to actually manage this program. Really didn't know much about it, and applied for the job and got it. And this has been the best experience, best professional experience I've had. And it's really tremendous to actually directly address healthcare needs for our LGBTQ community.
Well, and you sent me a really in-depth background on yourself and sort of the role you have there in the office that you run. You want to share a little bit about that with the folks watching?
Sure, absolutely. Our program was founded in 2012, honestly, as a response to medical students who said, hey, we're not getting the information we need to be able to take care of sexual and gender minority patients. So the first iteration of our program was really about building out curricular content. We quickly moved into patient navigation services. And I think a lot of people still don't realize this, but we actually have portals that LGBTQ patients can contact us, tell us who they are, what's going on with them, and we can help direct them to healthcare resources, whether it's at Vanderbilt or not. We certainly just want to help people connect to care. We provide clinical education, realizing that generations of healthcare providers have not gotten the information that they needed to be able to take care of the LGBTQ community. And we also foster research in our program, as well as assist in elevating our clinical services as well. We certainly have some rich clinical services that address the needs of the community.
No, that's fantastic. And having been a former Vanderbilt employee myself, it is great to have somebody as such an advocate, or an organization such an advocate for our community here. And speaking of advocate, little transition there, you guys are the advocate sponsor this year of this inaugural event. And so I wanted to chat with Selena a little bit about why putting this together was so important to you and Del Ray. And I think I can kind of piece those puzzle together based on what you've already told me. But Selena, I'll start with you, and then Del Ray, I'll let you tack on to the end there as sort of why this was so important and why now.
Sure.
Well, as I've mentioned before, we have become involved over the past few years with our community even more in depth than we have been. And, a lot of times we see people asking for gender affirming care providers, or a provider that may provide HRT. So you just see this over and over. And we also completed a couple of surveys. Well, we had one, and then we used some other surveys to actually put together what we thought was, well, what do you want? And they told us, well, healthcare is, one of our top priorities. So we knew that the community needed it. My wife is a nurse, and so she sees it a lot too. So we decided that we would bring this forward to people.
No, and you're exactly right. This has been an issue ongoing for a long time. In fact, we did a show not too long ago where I had a doctor on talking specifically about men's health within the community and some of the nuances that are involved there. And it was a very well-received show. I mean, and so we know whenever we get positive feedback or any feedback that it really rings true to the folks watching. Del Ray, I know sort of what Selena mentioned there, it kind of builds off of a lot of what you had said. What are some of the ways in which folks that might be looking for that type of help, where can they go to find it, at least through the Vanderbilt community or maybe even outside of there?
Sure. Folks can actually call or email us any day of the week. You can find our information to contact us at NashvilleLGBTHealth.com. That's an easy way to find our information. And again, we help provide those navigation services to help connect people to resources, whether it's at Vanderbilt or not. Being an academic institution, I have a pretty good window into what unique healthcare disparities our community faces. One of the issues is that our community largely doesn't understand what unique health disparities we face. And so we want to provide a lot more community education around that, as well as information about our patient navigation services and our clinical services as well. So when Selena reached out about this initiative, I got so excited and immediately asked our leadership if we could partner in this event, because it's a great opportunity to provide that kind of community education.
Oh, well, I'm excited to dig into the details, but we are going to have to take a short break, so we will be right back with more on the LGBTQ Community Health Fair after the break. Stay with us.